A very good evening, friends. Welcome to another edition of Meeting with Doctors from Shastho Bondhu. আপনারা সবাই জানেন যে স্বাস্থ্য বন্ধু আপনাদের সাথে সবসময় we are always with you. A special welcome to all my friends from Bangladesh as well as my friends from India. And I hope today we are going to have a session whereby we are going to learn a lot from a very eminent doctor, Dr.Nithya Ramamurthy from the Fortis Hospitals. She's a very senior gynecologist having more than 40 years of experience. So today is the day when we can count on these 40 golden years of her experience in her profession, which she will share with us, to which maybe, a lot of problems that the women face, a lot of gynecological problems that women face, you could get answers to that. So আজকের প্রোগ্রামটা একটা খুব বিশেষ একটা অনুষ্ঠান। এমন একজন ডাক্তার আমাদের সঙ্গে আছেন যার 40 বছরেরও বেশি অভিজ্ঞতা। তো আমরা আজকে সেই রকম একজন ডাক্তারকে পেয়েছি। So welcome Dr. Nithya Ramamurthy to our program. A very warm welcome from Shastho Bondhu to this program.
Thank you very much.
Dr. Ramamurthy specializes in high-risk pregnancy, in infertility, in obesity, in PCOS and laparoscopic surgery. She has won a lot of accolades in her life. In fact, it started with a student life. When she was leaving her student life, she got awarded as the best student from Women and Children's Hospital, Madras Medical College, and that was way back in 1985. 25 years back, 35 years back, she got this great award. And then, of course, awards continued to follow her. And the wonderful award she got was she was nominated and she got the award as the best doctor of Tamil Nadu, and it was given by the government of Tamil Nadu in March 2012. She's also the holder of the Malaysian Government Merit Scholarship. So we are extremely privileged to have such an eminent doctor with us today. So thank you, doctor, for accepting our request and joining this program today. We hope that, a lot of women who have a lot of problems, gynecological problems, would get answers through your session today. So it's over to you, Dr. Ramamurthy. I wouldn't waste any more time. The stage is yours. Share us some typical problems that women normally face in gynecology, and what could be the remedial measures, or what could be, they could do to overcome these problems. So the stage is all yours, Dr. Ramamurthy. Thank you.
Thank you very much for your invite me to this platform. And I also wish good evening to all my friends in Bangladesh. I'm Dr. Nithya Ramamurthy, a senior obstetrician gynecologist at Fortis Hospital, Chennai. My hospital was inaugurated in the year 1992, and we have very eminent consultants who are very committed and dedicated to their work. And of course, he's already has a So I will just, in a nutshell, I will tell you what is the commonest problem as a gynecologist I deal. The commonest problem today is dysfunctional uterine bleeding, or otherwise called abnormal uterine bleeding. The common age group will be from the age of 30 to 45. The incidence in India is about nearly 10%. So the causes usually I always think about 5 causes is very common. One will be anemia, the other will be diabetes. Thyroid can be either hypo or hypothyroid, any bleeding problems like coagulation defects or von Willebrand. And the other common thing will be the estrogen levels being very high. Of course, you can even drug-induced like aspirin or people who are taking blood thinners can have a tendency to have heavy bleeding. Now, when do you define heavy bleeding? When your periods are more than 7 to 10 days, you're bleeding heavily for 7 to 10 days, it can be associated with pain or not. And sometimes you have clots. The patient changes about 7 to 10 times easily. Some people even continue to bleed even more unless they take hormones or tablets to stop the bleeding. In this condition, history taking is very, very important. It is very important. And secondly, what I would do, there are different kinds of bleeding. Other than heavy flow, some patients come with scanty periods. Scanty periods can be associated with obesity or can be associated with long-term contraceptive pill or PCOD, all this. Some Some people have intermenstrual bleeding. Intermenstrual bleeding, which is starting at the end of the phase into like day 14, day 15. Some people have delayed periods. So these are different kinds of bleeding that people, or some people have like after 35, 40, 50, so these are the common causes. Most common causes other than anemia and diabetes and thyroid and coagulation, the other conditions other than drug abuse, it can be fibroid or adenomyosis mucus, or even the properties it gives to the disc space. Okay, so disc space properties to the cause of heavy bleeding. In other words, adenomyoma, which is the whole uterus is swollen, so globular uterus, sometimes it will be endometrium cancer. Otherwise, can multiply the endometrium, the cervix, or any ovarian cancer. These are the common causes for heavy bleeding or intermittent bleeding, or even after sex, postpartum sex, even the bleeding. So how do I handle this problem? So first, I listen to the patient, reassure them. And secondly, I will do basic investigation to see the primary cause of this. And this cause could be anemia, or it can be a sugar, to do the sugar levels, HbA1c levels, the thyroid, the coagulation. Then we will do a quick testing to work through the process, and whole abdomen scan is done to see the uterus. And whole abdomen scan is see the uterus to see whether it is a fibroid. The fibroid is something supporting the wall of the uterus that can be affecting the middle of the uterus. If you come from inside the cavity, one that is inside the cavity of uterus can cause heavy bleeding or intermenstrual bleeding. So then other condition will be endometriosis. Endometriosis is a very painful condition. The patient complains of pain prior to periods and the pain continues during the period. In endometriosis, the patient also will have pain with the other one will be adenomyoma uterus. So the whole uterus is globally enlarged, which is a very, very painful adenomyoma. So we have to investigate and the ultrasound will tell you these things. Then the next thing, of course, is your tuberculosis. And of course, in ultrasound, the most important is other than finding out tumors and endometriosis, is identify the thickness of the endometrial lining. When the endometrial lining when, reproductive age is between 1.5 or 1.2 to 1.5 centimeters, in fact, advising to have an endometrial biopsy or a hysteroscopic introduced BNP to see what was the reason for this bleeding, for thickening of the endometrium. And also, the cervix also has to be examined to see if there's any polyps, any erosion, or any ulcer, or anything suspicious of cancer. All these your examinations are very, very important for us to come to a diagnosis. Okay, then after sometimes some people have the fetal process that they can do the endometrial biopsy, which is about 90% accurate, or in some hospitals they do cystoscopy introduce BMC and biopsy. So now we verify find these systems. Sometimes the pathology comes back as simple hyperplasia or a cystic granular hyperplasia. How do I see? In this condition, I would advise them to after seeing the report, we can always ask them to take a hormonal tablet. So not many people are very keen on it. So we have a property called Myrina, which is a German myth, or an Indian, which is very good called NAD. This property has a hormone called levonorgestrel, which is inserted. So we introduce this property into the uterus, and this can be kept for 5 years. So the next 5 years, the bleeding comes under control. There's a regular period, the bleeding comes under control, and they can preserve the uterus. The only drawback sometimes they may have intermittent spontaneous bleeding, which can be corrected.
Excuse me, doctor, just a moment. I would like to welcome engineer Yusuf Ali Imon from Bangladesh. He's just joined us. I just wanted to say a hi to him. Carry on, doctor. You can continue.
Thank you. And so this is what we would use the MLE, which is very good. We can use MLE, very good or otherwise good. So the other thing is, okay, once if I see, the other finding in pathology can be disordered polycystic. When it comes to disorder, it means that abnormality is always present. But the most important thing is the cell. Yes, atypical cells, if they without atypical cells, it is safe. Yes, you can introduce this specifically for MLE to come to learn it. So the imaging is that every 3 months a biopsy has to be done to see whether any atypical cells. Why do I watch for atypical cells? If we become dysfunctional later. They learn to become anxious. So that you should always keep in mind. So this atypical self means then you should consider the further management. So this is how we treat learning according to the endometrial findings or the pathology findings. The next, when does laparoscopy come into picture? Laparoscopy comes into picture in the childbearing age group when they have fibroids situated in the serous layer or the myometrium. Through the laparoscopy, you can always remove the fibroid. Through the laparoscopy, when endometriotic cyst is seen, you can remove the cyst. If there are endometriotic nodules, you can abrade the nodules. If there are ovarian cysts, you can always puncture the cyst and release the fluid and preserve the ovary. And of course, in adenomyoma, you can resect the adenoma. So these are the advantages of doing laparoscopic surgery. So that why do you do this surgery? Because so that she can plan to have a child. But what if the fibroid is situated inside the cavity of the uterus? When it is situated in the cavity of the uterus, then we introduce a cystoscope inside. We introduce a cystoscope and we resect the fibroid out. Once you resect the fibroid, she is able to conceive after that. So these are the things to keep in mind for people who are planning to have a baby. So this is this. And then of course the cystoscopic then I told you. Of course there are other methods. There are people who want to conserve the uterus. Or there are patients who cannot undergo surgery at any cost. It can be a cardiac patient, an obese patient, or a hypertensive heart disease patient, or should have MI. On these conditions, you can always do endometrial ablation. What is this endometrial ablation? This is to remove the endometrial lining totally so that patient does not get period. About 30% of patients after this endometrial ablation, they do not get period. Okay? So thereby they're able to save the uterus for them and of course it's helping the comfort of the life. The only drawback when you do endometrial ablation, there are different methods of doing endometrial ablation, including radiotherapy, but it should be done with a lot of care in space. There is perforation or sometimes electrical imbalance can set in this procedure. So this is that. But of course, we have uterine artery embolization. When do you embolize this uterine? When there is big fibroid and it's not fit to undergo surgery. It's very old, very old, cardiac problems, doctor says just cannot undergo surgery. In such a case, we will inject horror in medicine into the cerebral artery. This medicine will go and block the uterine artery, thereby will stop the fibrosis. So there are various methods to conserve the uterus, provided there is no surgery. There are some people who have decided, okay, I'm enough with this. I don't plan to have any more babies. I'm completed my family. I'm only more than 40 years old. I would rather have surgery. This is preferably for people whose pathology like some disordered endometrium with atypical cells, any cancer. In such cases, we advise them to have surgery. The surgery can be open method depending or according to the patient's open method or they can go for laparoscopy. But laparoscopic assisted vaginal cystectomy or a total vaginal cystectomy has got its own limitations. But in this case, we have to decide the size of the uterus, the mobility of the uterus. Also, there should be a descent. So there's some amount of descent has to come for me to remove the uterus to the vagina. Or if she had previous cause, previous cesarean. In such cases, you should be very careful not to injure the bladder or the uterus. Or if she has comorbidities like hypertension, heart disease, or obesity, or your physician doesn't give treatment for a laparoscopy. In such cases, you will not have to think very carefully about doing laparoscopic surgery. Doing laparoscopic surgery, the keyhole surgery is minimally invasive, blood loss is less, and pain free. But it has been very popular today. We have done more than about 20,000 cases today now, successfully, but we have to select cases for laparoscopy. So this is in a nutshell. I've told you about the common problem which I face today. Dysfunctional different breathing, age-wise, and told you how I would see the person who is the reproductive age who plans to have a baby, or the person
Doctor,
is
you
there
just said that the age that you The age group for this you said is still 40, right? 40, 45, this problem that happens.
No, sir, it
What
can
about the
occur
gynecological problems that,
from the age of 30 onwards. Women come across this abnormal uterine bleeding. So we treat the
right?
primary cause. We have to treat the primary cause, identify the primary cause, and sometimes even the property which they are using
Doc,
can be good. That can cause heavy flow and pain. So once you remove this property, she becomes just like that. So simple, there can be very simple reasons also.
okay, okay. Doctor, I have a question. The question is that we also find, women who age, and a point comes when they go through a menopause, and a lot of complications happen. So, can you just give us in brief what are the kind of complications a woman going through menopause might go through? And what that person can think, okay, this is related to menopause. Certain irregularities start happening in the body. So if you can just give us an idea of the kind of irregularities that a woman might face when she goes through menopause, so that she's aware that
So,
this is
okay,
only because of
split
menopause
menopause
I'm
into
going
two
through.
groups. One
It
is
has nothing to do with anything else.
yes.
I think there's a network problem, ma'am. Somewhere I think sometimes you are getting. Is the network okay, ma'am? Yeah,
Yes. So if you take
yeah.
menopause, I
Yes,
will
carry
first
on, ma'am.
talk about I will tell you about perimenopause. Perimenopause is the duration 5 years prior to menopause. It's called perimenopause. In this phase, the reproductive hormones, estrogen and progesterone, their values will come down. And the menopausal hormones, FSH values, those values will go up. So, 5 years prior to that, the woman from the age of 45 to 50, from 45 to 50, she start experiencing irregular periods. She may have regular periods or she may have irregular periods. The periods can be scanty, the periods can be heavy. So accordingly it varies. Other than heavy periods or scanty periods, or she may not get periods for 2 3 months. Then suddenly she gets it. So it's an erratic cycle. It's because of the hormonal change. Then this she starts to experience common things called hot flush. Hot, hot flushes mean suddenly she bursts into sweat. Her body is becoming warm, sudden cold sweat, and then she starts palpitation also. So she's supposed to sit in a place and have a glass of cold tea. She'll sit under the fan and go. She panics. She thinks she's got heart problem. Actually, it's not. It's actually a heart flashes. It looks like a heart flash. So she starts sweating suddenly, and sweating, and then the heart is also beating very fast. And cold sweat, it makes her frightened her. So we tell the patient it's not a heart problem, it's still a heart because the estrogen hormone is strong. And so they also experience mood swings because of the hormone imbalance. They undergo mood swings, anxiety, depression. They find hair fall because once the estrogen drops, the hair becomes dry and hair fall is there. The skin becomes dry, sagging of the breast, sagging of the muscles, the abdomen becomes tenderness. Then they can have a dryness of vagina may have because of dryness of vagina they may have pain. So we allow we give them some lubricant to use. So we help them in every stage, we help them out. At the same time, we advise them they have a complete health checkup. So we see all the what are other factors affecting for life. We want to check for hemoglobin. But then towards 45 and what above 45, it's continuing to have BPM sugar. Fine. So we want to check the hemoglobin, the sugar levels, the cholesterol, the kidney function, the liver function. Also check the vitamin D. Invariably, in India, many women, vitamin D is very low. So vitamin D is also checked. And replacement are given to vitamin D. Second, we also do a mammogram to see whether the breast is. We advise to have a
Why?
mammogram
Why
every 2 years.
mammography?
Or
What is the reason for mammography? That is
the breast cancers are very high. The breast cancers have gone up. So how do I identify the patient? So as when the health checkup package will also include a mammogram. So once a mammogram is done,
okay.
She feels okay, fine, I'm fighting. Otherwise, any kind of breast discomfort, the fear of cancer comes into her mind. So in our practice, we have all this: the hemoglobin, the sugar, the thyroid, the cholesterol, the vitamin D, the mammogram. Every woman at the age of 40, a mammogram is done. At least years once you must do a mammogram. There's a whole abdomen scan to see whether her uterus is fine, whether it's enlarged, whether it's got a fibroid or a tumor, or how the ovaries are. Everything is better. And also we do a pap test. A pap test, we do not do so many pap tests today. We prefer to do a test for LBC. We identify with the test whereby we identify any atypical cells or cancer cells. Okay, to identify. So that's a test to identify. So they are able to pick up cases very fast before they really end up having a trouble. So this is the LBC for to check the HPV DNA test. We do the DNA testing to see whether the cells have any precancerous or atypical cells or risk factors. Thereby, we are able to help the patient before she ends up having a cancer. Okay. So this is the complete test for all the perimenopause women to identify at least whatever problems they have. Also, we have to reassure them. And see, this is perimenopause. You're going towards menopause. So you're bound to have all these symptoms. In latter part of life, they might have BP, they might have sugar, diabetes, or they may have thyroid problems coming in, or they may have some type of anxiety, panic attacks. These are very common with people who are going towards menopause or in menopause. So we reassure them and we advise them to accept it. This is what you're going to go through. These hot flushes are going to come frequently, and this is what you have to accept it. And over a period of a year or two, this hot flushes will disappear. So this is very
Right.
important. So I advise them to have a health checkup every year to help them out and to advise them and reassure.
Great. Okay, doctor, now I will go to the other age group. That is absolutely the young girls who are just, getting their periods. So what kind of complications can a young girl face, initially when she is just getting into her periods? Like from a child, she's going into an adolescent. What are the kind of problems, as a parent, one could, think that the child, like often, we find, girls complain a lot of stomach pain and all that. So what are the things that as a parent one needs to look into when a child gets into, her periods and becomes an adolescent? What is your advice for parents? What are the things that we should look into?
Yes. So what we advise our the mothers is that when she finds that the child is developing secondary sexual characters. So when the child is about 10 or not, invariably the classmates talk about periods, so the child somewhat understands. But the mother should educate the child. We tell the mother to educate the child and expect when anytime when she has a blood stain, she should first primarily inform the mother. The mother should be more of a friend than a mother. You see, she has to understand. So some children panic, they sit and cry. Some children are brave. They accept it. They have an older sister who already counseled her about it. So it's fine. So most important is this. Today I find children are attaining menarche at the age of 10, 11. The previous time is about 12, 13, but now commonly I'm seeing the age of 10, 11. The mother gets very upset. How will I handle the child? I said, don't you ever get upset. You go get upset and panic, and how will the child react? So you have to be calm. You must tell the child this is very normal. If you are going through, even the grandmother have gone through that. So this is something very normal. Okay. So you should reassure the mother and tell the mother, okay, take good care of the child. And make sure she has a nutritious diet. Okay? Never do anything to make fatten her. That's very wrong. Don't fatten the child. But you must give a nutritious diet. And you must also can pad. And every 4 hours she has to change the pads. She must always carry an extra sanitary pad to school. Because we never know, sometimes it can come early. So about children who have attained menarche, the 30% will generally get it every month. Another 30% will get some 2, 3 months. Another 30% 6 months or the following year. So it takes about 2 years for the period to set right for this child. So the mother is, we actually have to find the mother first to
Okay.
groom the child. So tell the child, okay, not to panic. You just be cool and calm. This is very, very normal for you to just know how to handle. You have to change your pad, eat well. So those days when you're having periods, don't do any strenuous activities. So you have a heavy flow. And also, you must make sure when you use the sanitary pad, you must always wrap it up and put it in and keep it safe. All this cleanliness is very, very important. How to wash the private part. All this has to be taught to the child. We tell the mother. And in fact, we give a leaflet to the mother to see reassured how to give the food, when to change the pad, and whatever. Okay. So there are one condition called puberty maneuver. That is, the child bleeds heavily during puberty. Heavily means sometimes she changes about 6, 7 pads. The period can extend more than 10 to 12 days, or she can be bleeding one whole month. Sometimes the child becomes anemic. We had a patient the other day, the child was bleeding for a month continuously, and the mother took it lightly. She didn't take it seriously at all. When we brought the child to the hospital, the child's hemoglobin was only 6 grams. It's very, very low. So we had to admit the child and transfuse blood. Then we told them about giving iron tablets and check the calcium levels, and found out other related causes for this heavy bleeding. Heavy bleeding could be because of anemia. Anemia can cause not only heavy bleeding, but anemia can also cause painful periods of bleeding. So you must always make sure that you concentrate on the diet and give iron replacement. And of course, you have to make sure you have at least 2 glasses of milk every day with lots of green leafy vegetables, egg white powder. It's very important. So if you have unbearable pain, then they can always take a tablet called methylmethylinic acid or tranexamic acid. They can always take one tablet or 2 tablets which will relieve the pain for you. So painful periods in children is commonly due to anemia. Otherwise, if the sick person can always do the basic blood test. Above all, an ultrasound has to be done to identify the problem. We should not neglect whatever the light is. That's very important. So that's how we handle it. So we make sure that they don't exceed. Generally, 3 to 5 days is normal. If they exceed more than 5 days, a mother must take the child to the gynecologist and get the child examined.
Okay. Doctor, one very important area, what I would really like to ask you is, there is a very big problem today, which is there in India as well as in Bangladesh, because I go to Bangladesh very often, and I find infertility is a very big problem. Infertility in women, and people are very worried about this. That because of the high stress situation today, women going to work, the stress level is so high that the infertility rate has gone up very high, and we find a lot of people from Bangladesh as well as in India doing treatment for infertility. So what is your suggestion relating to infertility? And the other very important thing in infertility which I will ask you is that infertility is not a thing, it's not a magic that the doctor who is doing the infertility treatment in one try will give you a child. The doctor is not God. The doctor is a doctor, and it's a technical process through which a child will come in case of infertility treatment. But the expectation from the doctor is when a patient comes for infertility treatment is just in with one injection or with one try, I will get a child. So I would really like you to give a practical picture of infertility treatment, and it's not a fact that in one shot you can get again. If it's God's grace is there on you, blessing in one shot only you might get. But what does science say, and how does science work as far as infertility treatment goes? If you can just brief our audience on this, because you are specialized in fertility. That's why I asked you this.
Infertility, yes, it is an alarming problem too. And but first, the history taking is very important. You see, history taking is very. Are they living together? Sometimes they only meet for weekends, so sometimes the husband lives in another state and she lives in another. So these kind of problems are there. Or living in a joint family where the pressure on them will be too much. They expect to get married this month and have a child next month, which is not practical. Okay, so to have a child, the person must be mentally prepared. You can't force someone to have a baby. Fine. He should be mentally prepared to see whether I can conceive, can I bring up a child myself. So he should be prepared. So then, secondly, okay, when you want to have a child, you have to go and meet the gynecologist. Fine. So the simple things we ask them to do is, of course, to take folic acid with B12. Folic acid with B12 is very important. So the history taking. Secondly, is the period regular or irregular? Is she obese? If she's obese, then we'll put them on a diet program. We give her a diet program, and we'll have to do something simple like, of course, Google Fit comes to this walking 5,000 steps per day. I think that walking itself will help them to reduce weight, right? Then irregular period. What is the cause for the irregular period? Is she anemic or she's thyroid or she's got polycystic? Today, ovary is a big problem which is associated mainly with obesity. So now we'll investigate for obesity, PCOD. This is the commonest problem today. So in PCOD, we'll have to, other than the basic tests like the hemoglobin and sugar and thyroid, in where most PCOD people have thyroid levels high or the insulin levels are high. Some of the PCOD people have the male pattern, but the male hormone is high. So you have to treat the primary cause. Fine. You have this PCOD, invariably you have to give them metformin. While taking metformin, many patients will PCOD. So if you keep taking the thyroid has to be rectified or diabetes has to be rectified and the associated factors. And also, some people have this anti-sperm antibody which can be present in the sperm or in the uterus. When they have sex, it destroys it. So you have to treat them accordingly. And the most important thing, of course, when you treat all this and when you do all the basic tests, everything is over with, so you have rectified the anemia and sugar and thyroid and insulin levels. The prolactin levels can be very high in some cases. And when the prolactin level goes up, you have to bring it down because it stops ovulation or follicles don't come. So you have to identify that. You can also find the results in the ovary by doing the AMH, LH and AMH statistics. And it is secondary of the period to see whether the results are enough for her. So all these uh, basic parameters have to be done. And above all, please wait, I did a quick question because you know why I would show you a picture of my finger. This is the service. Sometimes 30% of the service is more is very tight. It is so tight it doesn't allow the sperm entry. In some 30%, sometimes they can have some polyps or the fibroid or polyp or chicken endometrium. So many we have to remove them. And third, something they can have a tubal drop for in sugar places. So they tube test. We identify all the things such as whether off internal office size or anything like that. So what we would advise so if you find the office very tight, if there's any polyp or a submucous fibroid or you find that when you do the HSC, the still is not doing it properly. So we would advise you to go for a diagnostic laparoscopy. This diagnostic laparoscopy is done under general anesthesia. You will dilate the mouth first. So once you dilate the mouth, most of them will conceive. They say you remember 20, 30 years ago, they say I did DNC. God, why would I run DNC? Your osmosis is very tight, not allowing your sperm to go in. So 30% should be there. So will identify, so we'll open up, then we inject the methylene blue dye and we clean the tube forward. If there are little blocks in the fingernail and that can be removed. And also when we introduce the microscope, if there's any polyps or a second endometrium, we will remove it. So a basic thing has to be done. You understand? So this has to be done and invariably most of them when according to them on the 10th day for a polycystic. To see whether polycystic to see whether from the 10th day onwards the polycystic starts growing. So day 14 or day 15, ovulation sets in and we tell them to try. Okay? If they don't have follicles coming on time, then we can give them letrozole or chromosomes is given to induce the egg for the eggs to come. And then we call them for sanity, which is then to ovulation. Sometimes HCG or HCG injections are given to check for the given to rupture the egg. These things are being some people have dryness of the joint. You have to pain feature. In some cases, when you think there's no infection or anything, there's infection of the vagina, we clear it. Either it's for dryness, if you can give them uh, drugs to cause redness of the vagina, to the infection. All these things have to be looked into. At the same time, there's a husband sperm if the sperm count may be less than 20 million, or the motility is very poor, or the liquefaction time can be prolonged, or they can have agglutination of the sperm cells. So in such case, we send them to the uroendocrinologist to help them to improve the count, to improve the motility, to get rid of the agglutination and to reduce the prolongation of the leaky substance. So all this has to be taken care of for them to help them to do. These are simple basic things which you have to look into. Unless the reserves against our AMS is very low, or if they had a stable block, in such cases we stick into the 5 years. And if the block becomes anything, we stick into the 5 years, or the reserves are very low, or the husband count is 50 days, like it means that the physiologist per year. Such things we have to advise them to get this. These are things that's how we help the public. But your basic parameters are very important before you proceed.
Doctor, another common problem amongst women that I have, when I have spoken to many women, I have found is they have cyst in their uterus. And especially when they have cyst in the uterus, to, keep it under control, they have to take a lot of medication. And that also affects them adversely sometimes, the medication for cyst. So, what is your advice to women who have cyst in their uterus, and how should they go about it? Is it necessary to operate, or is it necessary, they can carry on with their normal life, or do they need any special medication? Like, what should be their life management? Women who have cysts, maybe multiple cysts in their uterus.
I think there is no cyst in the uterus. There is cyst in the ovary. So,
Okay, sorry.
no,
I'm
I
sorry.
don't know.
This could be my lack of knowledge.
So,
Yeah,
in
yeah.
the uterus,
Okay.
I'm sorry, in the uterus they don't have cyst. Fine, there is a cyst in the ovary. So,
Right.
in polycystic ovary, many people think there is a cyst in the ovary. I would want to tell you that there is no cyst in the ovary. The wall of the ovary is thickened with fatty layer. So, this is the ovary, mind you. This is the ovary. Can you see? This is the ovary. So
Okay.
when you put on weight, when you gain weight, no, the excess fat will sit on the ovary. When the excess fat sits on the ovary, for the common it will appear to be like a cyst. It is not a cyst, just the fatty layer sitting on the ovary, which looks like a cyst.
Oh, okay.
Because I know many mothers bring the daughter and tell me she's having a cyst in the ovary. I said,
Yeah,
sorry,
yeah.
it is because these children have, or the adult will have an irregular periods. So I say, I'm sorry, it is not a cyst, it's just the wall of the ovary is thickened with fat. So when it is thickened with fat, the egg cannot pierce this fat and come out. So when it cannot pierce this fat and come out, there is no ovulation. When there is no ovulation, your periods becomes delayed. When your periods become delayed, you put on weight. So it becomes a
Uh-huh.
vicious cycle. It is called polycystic ovary. You understood? So the fat is sitting there. The tiny egg is just few millimeters fine. It cannot pierce this fat. So it remains dominant. So when it's dormant, what happens? You don't have ovulation at all. So when you don't have ovulation, what happens? You gain weight because your hunger pangs go up. So it becomes like a vicious circle. So now we advise them, we give a diet chart and ask them to start reducing weight. And this is called PCOD,
Oh,
in which case metformin along with myoinositol and dichloroinositol. This vitamin helps with PCOD people. And most of the time, it's set aside by itself. The next condition will be endometriosis. Endometriosis is like backflow of blood. The blood collects in the ovary. They are called chocolate cysts. So these chocolate cysts can be
okay.
very painful. The pain occurs at least a week prior to period and increases during period. It's very, very painful. Some of them are bedridden for a day or two. They keep for some warm compression of the tummy, that they have to take painkillers. But endometriosis can, in 30% cases of endometriosis causes infertility. 30% of infertility is due to endometriosis. So if it's just mild endometriosis, there are medications for it, like series. There is a Gynaecology which we are giving today. For mild endometriosis, once you treat, patient becomes. The problem with endometriosis is recurrent. Okay, so in the childbearing age group, once it or either it is mild, you can treat it. Otherwise, invariably we end up doing laparoscopy to remove the chocolate cyst. You have to remove the chocolate cyst and you advise them to conceive. So once they conceive, again after delivery, after a couple of months or a year, again endometriosis comes back. And how are you going to prevent this? So we ask them to use this property which comes with levonorgestrel called Myrinor or Emily. We ask them to introduce that into the uterine cavity to prevent recurrent endometriosis from. So this is common.
Okay.
Of course, for simple serous cysts, benign cysts, mucinous cysts, there are a variety of cysts. Some cysts with contraceptive pill will regress. Some will end up having dual laparoscopy.
Doctor, while I was, looking at your profile, I was seeing that you specialize in obesity also, along with, gynecology. And I was wondering how are they connected? Now that you told me that obesity is so important as far as gynecology is concerned,
Very important.
that is where I realized that why you specialize also in obesity as well as gynecology. I got the answer now. I was wondering, you are mainly for gynecology. So why suddenly obesity? So doctor, can you tell us that how adversely
Obesity
obesity
is a
can
growing
affect a
problem
woman?
today.
How
Obesity,
can adversely affect a woman? What are the adverse effects of obesity for a woman?
obesity if you take in menarche, obesity in menarche can either cause irregular periods or can cause a heavy flow. Similarly, in a childbearing age group, obesity causes polycystic ovary. Obesity can cause excess of weight gain. Obesity can cause polycystic ovary. It can cause diabetes. It can cause hypertension. Above all, a person can get arthritis very early. Because you're so much of weight is on a child by all your weight. It's on your knee joints are bearing knee and so, well, all of them complain of knee joint pain. So knee joint pain and backache can be always associated with obesity, not only due to bad posture or vitamin D deficiency or calcium. Obesity is one of the main causes for joint pain, especially knee joint pain. So obesity is a
Okay.
big problem today. So I always tell everyone to be very careful with it. Diet as much as possible, cut down sugar.
I got it. I got it.
And sugar is the
And
root problem for illnesses, diabetes or sugar. People take excess of sugar, excess of sweets and all that. They end up having health problems. So I always tell my patients to cut down. I know it's very, very difficult to give up chocolate and ice cream, but I tell that you want to look good. When you want to look good, you pay a price for it. So you have to give up your sweet item to remain fit for the rest of your life. You don't want to have diabetes and hypertension and heart disease. You want to have a
actually,
good
doctor, what
quality.
has happened today? This is the current lifestyle. You see, people go through a lot of stress. Today, if you see women, people like you who are working today as such big doctors in Fortis, obviously your stress level is very high. Now, some people know how to control it, some people don't know how to control it. So one way of controlling stress is, on weekends, go to a restaurant, have fast food, go to KFC, have fried chicken, have a lovely ice cream whenever you want, have a, and good stuff, you want to eat because, you're earning enough money. So, money isn't a problem. Go for a lovely holiday. You don't work at home. Earlier, our mothers, they used to work at home. Nowadays, women don't work because they have plenty of maids to work at home because they're going out to work. And work has also become sedentary. Earlier, I used to see my mother cleaning the house, grooming the house, cleaning the furniture of the house. She was a physically active woman. And today, at the age of 80, even at the age of 80, my mother is a very active woman, physically. Whereas the women of today, they fall back mainly on maids because their excuse is we work and we earn. So we can't do household work. So all this together, doctor, is causing a big lifestyle change in women, whereby, the stress is now coming out in this way where they are indulging a lot of things which are adversely affecting their health, especially as you said, obesity is one of the major problems, not only in women, it's also in men. It's as much as in men as much as in women. But it's a problem. I think it's mainly because of the lifestyle change that we all had to go through, with time, which wasn't there earlier. Today, a lot of diseases have come, which was not there earlier. I'm sure you will agree with me. A lot of new diseases have come, which were not prevalent before. During our mother's time or grandmother's time, there were a lot of things that weren't there. But today, a lot of new things have cropped up. And it's mainly because of our lifestyle. That's how, the body has responded. So I think this is mainly the cause, where, people are getting obese. and it's adversely affecting their life. As you said, cyst in the ovary is also because of obesity. It's a fat layer in the ovary that is forming on the wall of the ovary, and it is causing further damage to the woman. The other very important question when I talk of lifestyle, doctor, this present current lifestyle, the lifestyle of women have undergone a very big shift. And I'll tell you very honestly, today I see young women smoking on the roads in Calcutta. I find a lot of young women smoking. They're not yet married. Now, I just want to know that smoking and the all the evils that go on with the current generation, how can they affect a woman as far as gynecology is concerned? How can all these evils that go around with the present social norm affect a woman, especially from the gynecological point of view? This is my question.
Okay, I want to say this pandemic has been a learning lesson for all of us. Yes, ma'am. I wouldn't know how it's in up north, but in Chennai, pandemic has made many women had managed their homes by themselves. They had to do all the housework by themselves, washing, cleaning, because no maids were allowed to come into their house. Okay, so this is what, because I find so many of my patients had lost weight. So she said, no, doctor, you wouldn't believe me. I did everything by myself. And I cooked. Did you enjoy it? Yes. She said, I enjoyed it. Because she said, when she cooked, the family was very happy, the husband and children. So she knew happiness was where the happiness was coming. Though they are working, but today they all are doing online. Most IT sectors or teachers. As a matter of fact, in Chennai, is a lot of online. So, and above all, because of this online, most women are, when children, I think my neighbor's child, which is but hardly 12 years, she's baking cake. So all of this pandemic has been a real good learning lesson. I find most people or most men and women have learned a variety of food or whoever they have looked into the menu of different states like that people in Chennai would look into Kerala or Hyderabad or Bengal for the style of cooking fish. I see many people have tried variety of things. I think this pandemic was a learning lesson, and most of them have understood the value of relationship, value of money, and so many things. So I think they would change. But when it comes to their habits and all, I think okay, I'm not able to comment on that because it's their individual thing. But when they come to see me or
I
they
would
planning
want you
to,
to tell us how will it affect them. If you can just give up, these
when they
wrong
plan to come,
lifestyles, how can it affect them?
okay, when they are going to come to see me, fine. So I will definitely ask the lifestyle. And when they're planning to conceive, when I get the history taking, then when the don'ts are coming, when the don'ts are coming regarding diet, everything, I said you must stop smoking liquor or you're taking any drugs. All this has to be stopped because these have an impact on your child. It will affect the child's brain growth or the skeletal growth. All that will affect. And then rest of their life, you might be carrying a cross and crying, saying that because of you only the child is got us. So women, I tell them,
Okay.
when you're going to plan to have a baby, then you cannot smoke, you cannot drink, or you cannot take drugs because it definitely will affect the child's brain development, bone development, heart, all this, and then you will feel guilty rest of the life. Yes or not? So you should be aware. So I think this, I think somewhere, I think the TV and all that should carry social awareness that
Yes.
smoke, you see, already they're saying smoke, don't drink. In spite of that, if the public does that, then I cannot say anything. Because today
No, no,
people listen in
ma'am.
India.
Why I raised this issue is that they write that cigarette smoking is injurious, but how is it injurious? No one, tells in that cigarette packet. This can cause brain damage to your child. This can cause bone damage to your child. Whoever is coming to this world, you are going to get an imperfect child because of your imperfection. No one highlights that. Through Shastho Bondhu, I wanted to pass on this social message to the world that, follow a proper lifestyle. If you have to keep yourself fit in always, and especially for women who are going to be mothers, women denotes motherhood. So it is very important to understand these little things which today may look like, glamorous, today may look like the in thing, but tomorrow you might have to regret. My idea is, why regret tomorrow when you can actually avoid something it's not necessary, it's not needed, which is not, you know, uh, absolutely not needed, which can actually harm you. Not only harm you, can harm you through various other things. It can cause cancer or other things. But most importantly, the newborn which is coming, when you become a mother and you give birth to an imperfect child, and then you start crying, why did I do this? And then, your hands are on your head. That why did I do this? Why didn't someone stop me? So today's message from Shastho Bondhu is, lead a proper lifestyle, not only smoking, drinking, even stress. Today, young women are getting into jobs, and before they get married, before they conceive, stress also has an effect on the child, the child which is coming. So it's a complete, 360 degrees which one needs to know and realize and understand. Because a woman, the most important role for me as a woman is a mother. If you ask me, when you look at a woman, what is the most important role of a woman you see? If someone asks me, for me, a woman's most important role is that of a mother. Nothing could be.
Yes.
You are getting a newborn to this world. You are, someone, a new creation is being brought to this world through you. That is where I think this message was very important from Shastha Bandhu, that lead a good lifestyle. I think today's, in a nutshell, Dr. Ramamurthy, if I have to say, is that more than the technical aspects, what you are saying is, have a good lifestyle. If you want to avoid gynecological problems, obesity problems, and all health related problems, what you need is a proper lifestyle, a stress free lifestyle, and focusing on correct food, having proper food in time. All these things are very important. And of course, consult your doctor. Very important. Whenever you have some problem, go to a doctor like Dr. Ramamurthy can always guide us, show us the right path, a senior doctor like her. So I think this is in a nutshell that I can say that, that if we can lead a proper life, a proper lifestyle, we can avoid a lot of gynecological problems, lot of issues that come in our lives, and we can lead a happier life. Am I right, doctor? Am I right in whatever I said?
See, like our mothers should have taught good values in life for us to cherish. Okay, so that's what we should. As long as you follow whatever your mother taught, those good things, and you live a disciplined life, invariably I think life should be fine. Stress is going to everyone has stress, some kind of a stress. Even a little child today has a stress. So I think how you take the stress,
Right.
how you approach the stress, and if you think some people find comfort eating during stress time, but if this comfort eating only you're going to become obese, fine. So if you have some kind of stress, I think we have a problem. First, you accept the problem. If I have a problem, I would accept it. Then I will sit and think how I can solve it. Or I can share it with my husband, or with a very good friend, or with my family. At least if I share it with them, half the burden is gone. And also a solution will come. Sometimes I could have solved it today. Sometimes I could have done it 1 week or 1 month later. But you must share it with the right kind of person to um, help you out your stress. But as long as your life is disciplined, I think things will fall in its place as long as you're disciplined. Like if anything that you will do wrong, something inside you will say, if I was to smoke, something inside itself, don't do that. If I was to do beyond that, that means you can't help it. It should come within you. That's right. It should come from within the person. I don't think anyone can tell you do this and do this. You're grown up. Grown up is quite old enough to think for it.
Right. Absolutely. Absolutely. Uh, Thank you, Dr. Ramamurthy. It was a wonderful session that we had with you. There were a lot of learnings, and I hope people who have seen the program have really enjoyed watching it and have learned a lot from you. And whenever we get patients from Bangladesh relating to gynecology, we will surely refer them to you with a doctor around 40 years of experience. I don't think a patient would get better advice from any other doctor than you with such tremendous accolades behind you. So we assure you that if we get patients for gynecology, we'll surely refer them to you so that they get the right treatment. For Shastho Bondhu, our objective is that our patients are served well, they get proper treatment, right treatment from the right doctor, they get a right path. They are not misled of any way, they get the right path and their problems are solved. And with a doctor like you, we are very confident that our patients will definitely get the right solution. So thank you for joining us in this session. We wholeheartedly thank you and Fortis and of course Shoptalk for organizing this program. And we look forward to doing many more programs with Fortis, with other eminent doctors of Fortis. And we would like people to get more knowledge about various diseases. And স্বাস্থ্য বন্ধু আপনাদের সাথে আছে, থাকবে সর্বক্ষণ পাশে। আপনাদের যদি কখনো কোনো শারীরিক কোনো অসুবিধা হয়, স্বাস্থ্য বন্ধুকে যোগাযোগ করুন। আমরা আছি আপনাদের পাশে সবসময়, আপনাদের সাথে সবসময়। আজকে আপনারা দেখলেন ডক্টর রামামূর্তি মতো 40 বছরের অভিজ্ঞ গাইনোকোলজিস্ট আমাদের প্যানেলড আছেন। ওটিসের মতো হাসপাতাল আমাদের সাথে প্যানেলড আছে। আমরা আপনাদের অ্যাসিওর করতে পারি আমরা যে সার্ভিস দেব, যেভাবে সার্ভিস দেব, আপনাদের যে সমস্যা সেই সমস্যার সমাধান আমরা নিশ্চয়ই করতে সাহায্য করতে পারবো। তো আশা করি আপনাদের এই অনুষ্ঠান ভালো লেগেছে। আপনাদের যারা যারা প্রোগ্রাম দেখেছেন তাদের সবাইকে আমার ধন্যবাদ। I thank everyone who has seen this program. I would again once like to thank Fortis and Dr. Ramamurthy before wrapping up. Thank you.
Thank you very much.